Hi, I'm Neha. I'm one of the current surgical pathology fellows at Iowa. I am originally from Kathmandu, Nepal, but I've been in Iowa now for 15 years or so. So now I just like to consider myself an Iowan. I did my undergraduate and medical education here at the University of Iowa, and then I ended up staying here for my APCP residency as well. After each point in my career training, I've said, oh, I'm going to leave Iowa, but then I end up staying here anyways, and that has to do with primarily with two different factors. One, the people, and two, the caliber of the training here. One of the previous trainees at Iowa once remarked, there's nice and then there's Iowa nice, and he was absolutely correct. The people here are very nice. We have the trainees, we have a very tight-knit group who are always willing to help each other out, regardless of if it's an issue that came up at work or even outside of work. When I was a second year resident, I had to take 2 weeks off for health reasons, and all of my core residents stepped in, covered for me at work, and I didn't even really have to ask them for help. Along with the trainees, the faculty are also all very approachable. I always feel welcome to walk into anybody's door at any time to ask them questions regarding cases or career advice, or just even something unrelated to pathology like vacation training. I remember when I was a third-year medical student, I would just walk into some of our senior faculty members' office and just sit there and chit-chat to them about life, and I wasn't even on a path rotation then. I can confidently say that during my time at Iowa, I have formed lifelong friendships as well as mentors, and I'm very happy to have done so. The residency training at Iowa is excellent. We have a very balanced AP and CP training, and with faculties that are not only just experts in their field, but that have a real passion for resident education. While I enjoyed all of the facets of my training, I have a passion for surgical pathology as well as cytopathology, and so I'm doing the Surg Path Fellowship now, and I will be doing a cytopathology fellowship next year here as well. The Surg Path Fellowship at Iowa complements the residency program excellently. It basically complements and augments the AP education we receive as residents, but then you also get a level of added autonomy that comes with being fellows. So whether that be calling back frozen sections on your own, or fellow sign out, which is something we do the second half of the year, where we actually sign out our own independent cases. So putting all of those things together, you become an excellent, competent pathologist. So I feel confident that my training at Iowa has prepared me for my future career, and if I had to do it all over again, I would still choose to do it the same way.